Or, I don't know what to say. Thanks very much for that glowing introduction. It is great to be here. I have travelled a long way, but already it's worth it because you know, I can feel the energy in the room around this subject, and it's a subject very close to my heart. But to sort of backtrack a little bit from that glowing introduction, I haven't been working in systems for very long. I've been working in physical activity for many, many years. But the system stuff is all quite new, isn't it? I think it's new for many of us. Sport England, you know, have adopted the term, and for some organisations I've worked with, they've actually found it sort of pushed on them. Oh, we've got to work in whole systems change now. What does that mean? People have been asking. So it's new to many of us. But I've been working, and I put Harry Rutter's name on the slide there because I've been working with Harry for a couple of years now on this issue of systems, and in particular systems mapping, which I'm going to focus on. So Harry Rutter is the real expert in systems thinking. He's got a new professorship on systems thinking at University of Bath, and he's grappling with this idea of complex systems across obesity, across the public health system, across sustainable transport, and loads of other big issues. So I think this was the title I agreed to, Seeing the Bigger Picture of Whole Systems Change. And then when I saw the programme come out, this was added to the bottom of the title. What is this scary picture? And I thought, oh, what is this scary picture? And I think what it refers to is this horrible thing. Anyone seen this? Stick your hands up if you've seen this thing or you're familiar with it. Yeah, the Foresight Obesity Map. Those who haven't seen it, what's your first reaction? Just shout out a word. It's just hideous, isn't it? It's hideous. So, on the plus side, Foresight, the Government Office of Science, really introduced the concept of systems thinking to the public health and, in many senses, to the public sector a number of years ago. And really got people thinking, certainly in terms of obesity prevention, about the issue of complex systems, about the fact that it's not just one or two or even 3 or 4 separate, disconnected issues. It's kind of everything working together. But on the downside, everyone just says, oh, what a mess. And the risk is, of course, if this is what complex systems is about, then I reject it because it's, you know, too scary and horrible. And of course, for good reasons, that's often referred to as the spaghetti diagram, because it just looks like, you know, a whole mess of spaghetti all on the plate. So let's have a think about what systems can be and how we can use systems thinking to tackle physical activity. So we've had a great introduction already about the issue of physical activity, and really we've ticked so many boxes now. We know what to do, we know what the messages are, the Chief Medical Officer has told us this many times. We know where the areas of highest impact are, don't we? We know this idea of a dose-response curve, that if we get the sedentary, you get a greater level of health benefit than if we get you lot, you know, active people, to do a little bit more. So we know this is a clear issue in terms of targeting, and clearly you've taken that to another level in terms of geographic targeting and working on communities of highest interest. And we know what to do about it, don't we? We know all the interventions that work. We've got the evidence, haven't we, for effective interventions? Or have we? This is the biggest sort of global review of evidence for physical activity interventions, and anything above the line works as long as the error bar doesn't cross the line. So we've got all these wonderful things that can work. But if you look along the bottom, you can see that they're all really individual level things. Giving people pedometers, I can't see it myself, working with like interpersonal things to promote self-efficacy. Workplace is a bit big, I guess. Behaviour change programs. We've got this thing called the inverse evidence law. So the things that we think are probably most likely to make the big difference, changing the environment, changing the system, building places where people can be active, there's very little evidence for. The things that work on an individual level, we've got lots of evidence because they're easy to research. So we're in this problem where if we just do evidence-based action, we're probably likely to do more sort of downstream interpersonal interventions, more of the same. That we've been doing for years. And so, you know, Sport England are to be encouraged in taking the bold step of saying, let's try big things and let's try things that might even fail. Because, sure, I'm a big fan of evidence-based action, but if we just follow the published evidence, we'll be doing more of the same. And so what we find ourselves doing is promoting, you know, using information programs that talk about, in this example of the guidelines for a healthy diet, and putting up interpersonal health promotion advice in a hostile eating environment. This is actually, I think this is gone now, but this is actually Southampton Hospital NHS Trust, where they had a Burger King to make some money. We find ourselves employing interpersonal interventions to promote walking and cycling. So this was from a randomized controlled trial done in Glasgow that was effective in increasing walking. It doubled rates of walking by persuading people, basically. But we employ these interventions in a hostile walking environment. This is Manchester Piccadilly Station, where they seem to think you can't even walk, whatever that is, 20 metres without being dragged along by a carbon-emitting walkway. We promote cycling in a hostile cycling environment. Have you ever seen such a ridiculous piece of cycling infrastructure? Again, happily now gone, but some idiot obviously read the design manual for roads and bridges, and it probably said under clause 72 or whatever, every place where there's a crossing needs to have a cyclist dismount sign, and so they put up 17 of them, and each of them costing hundreds of pounds. My point is, what's the point of just thinking about small-scale, downstream interpersonal interventions when we're in an environment that actively supports physical inactivity? So systems thinking, there are lots of Harry's really good at metaphors and analogies and similes and all the rest of it, but the best one, I think, is this idea of a balloon. If you've got an inflated party balloon and you poke it, what happens? Nothing. The impact of your intervention is just absorbed by the system. What happens if you poke it on both sides? Nothing. The system reacts in a reinforcing way to these multiple interventions that we keep trying to do. And what we find is that these things that may be effective with small groups of people or individuals are just almost little points, just little jabs in the system, and it's not making a difference to the whole thing. A system approach says, let's actually tackle it in a big way. Let's either deflate or burst the balloon. And really, one of the best examples, as has been mentioned already, is probably tobacco control. And I think, in a way, this was an accidental system approach, because when some of this work began years ago, in the last century, earlier this century, there wasn't really the talk of systems approaches. But if you look at all the things that have happened, this is from the US, but if you look at all the things that have happened from the Surgeon General report through to various initiatives, you can see that, and same in this country, of course, that smoking is being tackled from all fronts. It's been tackled in terms of messages on packs, as has been mentioned. It's been tackled in terms of counselling and nicotine replacement therapy. It's been tackled in terms of law and secondary smoke, and it's been the ban in public places and so on. And you can see that what the tobacco control lobby and activists have been doing for many years is basically thinking, what can we do? Let's think of everything that can be done to tackle this problem from all angles, and let's systematically do it. Now, as I say, whether they planned that as a system, I don't know, but really what has come about, I think, has been a systematic and continuous attempt to tackle this public health issue from all angles by a range of different actors that has resulted in a significant success in terms of reduction in rates of smoking. We're way behind with this, and we need to catch up. So is this a system? Is this the onion or the rainbow, whatever you want to call it? Well, I've been a big fan of this socio-ecological model, is the proper term for it, for many years. It was initially coined to look at the influences on health of an individual. So it was saying certain things are unchangeable within an individual that may influence their health, their genetics, their sex, and age, and so on. And those can't be changed. But there are things at different levels that influence health. But as has been mentioned already, this model has been turned around and is very usefully used to look at the levels at which we might intervene. So saying, well, there are things we can do in the social environment, there are things we can do with organisations, and so on. And I think later you'll be doing an exercise that will be very useful in kind of categorising, to help people think, what can we do in workplaces? What can we do in the wider society? What can we do with the built and natural environment? But I don't think this is a system. I don't think this diagram should be used by Sport England to demonstrate what systems change is, because I don't think it shows the complexity of the relationships between all these different areas, or between all these different actors, and between all the different levels of intervention. I think A systems approach, unfortunately, is more complex than that and has many, many more relations. And that's what I'll try and show you with these mapping. And again, my sort of guru in this area, Harry Rutter, often talks about the difference between complicated and complex. And a lot of people, including me, found this very helpful initially in thinking through complex systems. The Saturn rocket is complicated. If you've got all the right bits and you know how to put them all together and you push the right button, it will take off and it will hit its target and return to Earth. It's a complicated process. Things can go wrong, sure, but everything connects together, and there's a relationship between each component of the rocket, and it'll work. What we're talking about is far more complex, because we're talking about human relationships. We're talking about unpredictable behaviours. We're talking about unpredictable responses to changes in the system. That's complex. We're not able to predict exactly how people will respond to any public health intervention we do, and we're not able to predict the unintended consequences, good or bad, that might come out of that. And so we need to think more about the complexity of the system we're working in and try and look at the ways that things relate to each other. And one way to think about it is to sort of compare and contrast, like a sort of linear approach, the way many of us have been working on these sorts of issues, with the surrounding factors that make something more complex. So this is an example that Harry uses. Again, I've stolen this slide from him, about the sugar tax that's come in now? Yes, of course it's come in now. And this is really the sort of linear model that you might think of in terms of if you were trying to evaluate the sugar tax. This is what it's trying to do. It says if we implement the tax, that will put up the price of sugar-sweetened beverages, fizzy drinks. That will lead to people buying fewer drinks. That will mean reduced consumption, and that will influence obesity. That's the kind of, at the heart, isn't it, of the logic model, if you like, of what we think is going to happen. But if you take a sort of broader view and think through, yeah, but what if type scenarios, you can see there are many things that might happen on that pathway. As the tax was being introduced, there was no end of political lobbying, persuasion, offensives by the sugar industry trying to undermine the sugar tax itself, and trying to reduce the magnitude of the tax, trying to get it stopped and so on. There are issues happening with prices of, some prices aren't going up as a result of the tax. Manufacturers and retailers are putting the price down so that the tax keeps the actual retail price at the same level, and so on. Lots of other issues that we need to sort of think more broadly to see, well, what might happen there. And so this is the result. So this is the, they're called causal loop diagrams. This is the systems map, basically, or causal loop diagram, that Harry and his team produced for the sugar tax. And you can see that this is the sort of linear bit. This is what we think might happen. But these are all the other things that might happen around the outside. These are all the forces that might support that eventual aim or outcome. And these are all the things that might support them or might scupper it, might reduce its impact. And so an investigation or an evaluation of this type of system might say, well, actually, let's look at and measure some of these more interesting and less well-known issues. Rather than just measuring consumption and purchase, let's look at some of these broader issues. And so the evaluation team for this systems project are measuring public discourse, and they're looking at press clippings, and they're analysing the way that the tax is being received in the media. And so that's what I think is helpful with physical activity, is to think about all the ways the system operates, and I think a first step is to try to map it. So one of the things that Harry and I have been doing is learning from this guy, Steve Allender, who in Australia used systems mapping to look into obesity. And this was one of the first systems map that we did for physical activity. This was from Derby, and still working in Derby and doing a follow-up mapping process soon. So what are these things? So this is just another version of the Foresight Map, the horrible spaghetti map, but we're trying to simplify things a bit. So what are these things basically show the relationships between factors. So here is a good example. This says, if there is quality cycle infrastructure, that will increase cycling for transport. and there are some negative ones somewhere, I can't find them. Yeah, if there is poor weather, that will reduce cycling for transport. There's a little minus sign somewhere. So these sorts of maps are produced as a result of stakeholder input, ideally from a blank sheet, where people sit in rooms usually smaller than this, and say, right, let's think about all the issues for physical activity in our area. What's important more generally? What are the things that can help or hinder physical activity? And also, what are the important issues in our specific context? What are the barriers and what are the motivators or enablers to physical activity? And using the systems mapping software, we're able to put them into sort of categories and draw the connections and so on. And so you can see that over here, in this example, over here is a kind of environmental stuff, cycle infrastructure and parks and so on. And over here are the more individual interventions or things that might influence or look at people's sort of motivations to change. And when we took this to the multi-stakeholder alliance in Derby, probably like your steering group, they found it extremely helpful, because they started to use it to look at the data that they had for their system, but also they almost had a light bulb moment and they said, we're hardly doing anything on the environment. So in Derby's case, they were taking what they said was a whole systems approach to promoting physical activity across the city, like you really. But they had virtually no one on their committee looking at parks and green spaces and transport, cycling and walking. And everyone was concerned with these interventions, web-based motivational interventions to get people to exercise more. And it wasn't until we put this map up and got them playing with it and drawing lines and so on that they said, oh yeah, I get it now. We're really not doing much in this area. We're doing lots over here. And so these maps can elicit lots of different responses, I think. We hope they don't make people go, oh, it's just a mess, the spaghetti effect, you might call it. But we find they help people to see the whole system on one page or one slide. Perhaps that helps actually to simplify things, because you can say, oh, I see, so there is an issue with the environment, but there's also issues to do with social norms and the public image of cycling, walking, physical activity, which I think is very important, as has been mentioned already, what your friends and colleagues and peers do. And there's also stuff going on over here to do with, these are the exercise referral scheme that we do is over there on the right. But actually it's seeing how some of these things are connected and seeing how some of the changes can influence other changes. And also we found it helpful that people sometimes can say, oh, I see where I fit in now. So I thought I was just working on my little project and sometimes I feel as I'm not part of this system. But now I see it as, graphically as part of a system. I can see how I can contribute to a greater whole. Just because you're not in charge of a systems-wide approach doesn't mean, of course, that you're not part of the system and you can influence it. Another example, using slightly more fancy software to make it look slightly nicer, is a county-wide system approach that we're working with Gloucestershire, who interestingly were, I think they were near finalists for the LDP money, and they didn't get as far as you did, but they still got the alliance together and they want to keep going. So Gloucestershire, we started with this sort of map that just had a few connections and then workshopped it and produced a far more detailed one where we were able to sort of split up the different issues, the biological or the things that we can't really influence through to influences of the family, at the individual level, and the environment and transport and so on. And again, they found this helpful in saying, right, well, if we're going to really take a systems approach, it's not really a question of sort of ticking off every circle, but it's a question of saying, which of these things then do we actually think are the most important to begin with, and how can we tackle the majority of the system over the whatever period. You said 10 years, I think it's probably 20, 30 years to make systems change, but still, that's another discussion perhaps. But it's really, it's using this type of mapping to say, well, what can we do about parks and green spaces? What can we do about cycling in this area? How can we support people to make positive behaviour changes as individuals? How can we make sure that they are positively reinforced by their families and by the wider environment as well? So it's looking at the connections between issues. That's in Gloucestershire. And working with WHO in Geneva on the recent global physical activity global action plan, where they also took this idea of a systems approach and trying to connect all the different actions and see how they make a different system. And in Gloucestershire, we use that model to to workshop the map. So this is an example of the messiness of systems thinking, systems mapping, where you get these horrific diagrams covered in all sorts of scrawl and graffiti, and then I have to take them back to the office and work them out. But what this is a group looking at the systems map they've agreed, so they've said, oh, this is what we think our system looks like across our area, and then analysing it and saying, oh, well, these are the things that we think we're doing well. These are the areas where we think we've got challenges. The green is the things where we need to focus, we need to do more. And so it enables them to think, right, what we do in the first year, what we do in the second, fifth, 10 years, and so on. And that, I'm sure you can't read this, but this then is a map of systems actions. So these are showing all the different things that are going on or might be going on across Gloucestershire to achieve the systems change. So they're able to sort of use this approach to plan, map, and categorise and bring together a range of different actions. And finally, also to help focus on evaluation. So by setting out the system and sort of analysing it in this way, you can say, well, we said we were going to have this plan here. Let's think about that. Let's focus on that and think, how was the plan implemented? How many of these things actually happened? So, I would encourage you to think big, to map the system if you can, and to use that to say, what are the biggest things from the scientific literature that we know make a difference, but how does the literature support our action for the things that we think are most important to us locally? What do we think is going to get the ball rolling and move us more towards taking this broader approach that combines action across a range of areas? And we've got a paper in press at the moment trying to do this, produce a sort of relatively generic map for physical activity that might be a starting point for people who want to produce something that's more relevant locally. So this map is an attempt to look at all the issues that are related to physical activity from the academic literature, put them in a systems map, and then that would be a starting point for people to say, oh, well, okay, maybe the literature says air quality is an important issue, but actually that's not an issue for us locally because we've got good clean air or whatever. It enables you to make sure it's relevant locally. So, in conclusion, as I said at the beginning, if we just take an evidence-based approach, we're likely to focus too much on downstream, individual level interventions. We need to move upstream and think more broadly. And not just focus on risk factors that are close to the individual, but think about tackling this at a societal level. And Harry talks about disturbances within systems. So it's not necessarily, I'm going to do this thing in order to have an impact and that would be immediately measurable. It's about tackling the system and disturbing the system. So we may be, cycling was mentioned, we may well be interested in promoting individuals to cycle more, and of course we should measure how many individuals cycle more. But we also want to change the cycling culture. We also want more people to be seen out on bikes. We want cycling to be more acceptable. We don't want people to think, oh, it's easier to get in my car, I'll do that. And those things are hard to measure and hard to do, but they're bigger, more societal issues. And certainly we have to see this as a long-term issue. It's great that Sport England are funding these projects. As usual, as with all these sorts of things, the funding cycle is pretty short. But I applaud your ambition to see this as a long-term challenge and wish you the best of luck. Thank you.